This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Good morning. Welcome into the program, Mon Health Talk. Dave Wilson with you. Our guest this morning is Dr. Byron Dodson, surgeon with Mon Health Surgical Care. We'll get into the subject of breast cancer surgery this morning. But first, let's welcome Dr. Dodson into the program. Good morning, sir.
Good morning. Thanks for having me.
Hey, thanks for taking a few minutes before we get into the topic at hand today. Let's get a little bit of background on you. Tell us about, kind of give us the short biography there, where you're from, education, how you ended up with Mon Health.
Yeah, so, my name's Byron Dodson. I'm actually a West Virginia guy. I grew up in Ripley, not too far away. Ultimately went to medical school at the Osteopathic College in Lewisburg, did my surgical training in Johnstown, and came back to Mon Health. I had the fortune of doing my medical school rotations at Mon Health and just kind of fell in love with the facility and ultimately came back when I completed training.
What led you to wanting to be a surgeon?
I think most surgeons would say most of us are very instant gratification people. You like to see someone's ailment and be able to do a procedure over an hour or 2 hours and then immediately see improvement. That immediate instant gratification really drives me to see patients get better. And
so you mentioned you did your rotations at Mon Health, and did that just kind of stick with you when an opportunity presented itself?
Yeah, Mon Health is a community hospital. It's not a large tertiary care center, so it was the first hospital I'd spent a lot of time in, and, I love the fact that it was private rooms, and patients are just, the number one priority of this institution. I went off to train, and, not that there's anything wrong with the place I trained, but being in a very busy trauma center, it's just a different feel.
October is Breast Cancer Awareness Month. I think most folks are aware of that. You see a lot of the pink movement, or pink fundraising, pink outs, those sorts of things around town this time of year. So how do you factor in your role as a surgeon? And we're going to get a little bit more specific in the next couple of segments, but generally speaking, how do you fit into the breast cancer treatment plan as the surgeon?
Yeah, so breast cancer is truly a team approach. Generally what happens is the patient's women's health provider or family practice physician finds a breast mass or gets an abnormal mammogram, and then they send them to us. And most of us really like to truly take ownership of the patient's breast health at that point, and we see through the biopsy, discuss all the results with the patient, and talk to them about treatment plan and appropriate referrals to medical and radiation oncology.
All right, I want to get into some of the specifics, but I want to get a break in first so we don't get pinched by the clock here in just a little bit. So we'll dive into some of those specifics about the treatment plans and options and the surgeon's specific role in all of that. We're talking to Dr. Byron Dodson, surgeon with Mon Health Surgical Care, and the subject this morning, breast cancer surgery. We'll continue the conversation in a moment. You're listening to Mon Health Talk on WAJR.
Now back to Mon Health Talk, a discussion of the issues, people, and procedures in healthcare today. If you have a question for one of our healthcare guests, call now at 304-296-0041.
Our guest this morning, Dr. Byron Dodson, surgeon, Mon Health Surgical Care. We're talking about breast cancer surgery. So, Dr. Dodson, let's say a patient goes in for a mammogram. Something is detected there that needs further examination. They get sent to you. They get for a biopsy. Kind of pick up the process there. What are we talking about, number one? And two, just kind of walk us through what would take place for the patient at that point.
Yeah, so recently the service line leaders did a really nice overhaul of our process in that regard. It used to be you would get your mammogram, find out there was an abnormality, your PCP would call you and tell you about it. They would order more advanced imaging. You would find out about that several days later, and then a biopsy would get ordered after they were referred to a surgeon. With the new process they've put in place, those more advanced imaging tend to get done same day or the day after, and the biopsy actually gets ordered by the PCP or the obstetrician that found the issue, and they're coming to us shortly after the biopsy is complete to get the results. Some of us biopsy in office ourselves, but oftentimes it gets done through the radiology department.
Is that a walk-in, walk-out kind of procedure? Is that a day-long? What should the patient expect?
Yeah, so there's a couple types of biopsies. One's done under ultrasound, which is just putting a probe on the skin. The skin's numbed and a very small incision is made, and a biopsy is taken and the patient goes home. It's fairly painless, just the pain of the local anesthetic. The other kind of biopsy is called a stereotactic, and we use that when there's not a mass detected on ultrasound. There's just abnormal calcifications, and that's done in a similar fashion. It's just a different machine and slightly more uncomfortable than the ultrasound version.
Talking to Dr. Byron Dodson, surgeon, Mon Health Surgical Care, this morning on Mon Health Talk. If surgery is required as part of the breast cancer treatment plan, are there different types, and how do you go about selecting which is best for the patient?
Yeah, so broadly speaking, the two major types of breast surgery are what's called breast conservation therapy and mastectomy. Breast conservation therapy, as the name implies, the goal is to maintain the rest of the breast that's not affected. That's often done in very small tumors. Mastectomy, as many people know, is when the entire breast is removed, which can be, some women and men find that disfiguring. However, reconstruction is an option in that case as well.
Are there, I'm trying to ask this question delicately, is mastectomy ever a possibility as a preventative measure? Do you deal with those types of procedures?
Yeah. When you get into mastectomy for prevention, oftentimes you're talking about people who have the BRCA gene, which can predispose you to breast and endometrial and ovarian cancer. In those cases, oftentimes you find women as young as their late 20s who come in to have mastectomies done. There's many more options at this point as no cancer has been detected, and you can do something that's actually called a nipple-sparing mastectomy, where you only make a small incision on the outside of the breast, leave the nipple in place, and then immediately the plastic surgeon can reconstruct it, allowing the woman to maintain the appearance she had previous to surgery without the cancer risk.
What factors do you take into consideration when you are considering the breast conserving surgeries versus the mastectomy?
So the number one consideration is patient preference. People who are candidates for breast conservation therapy tend to have smaller tumors. And thankfully, with the screening programs we do with mammography, most tumors are found at a point where they could undergo breast conservation therapy. So the number one thing is, it's up to the woman. What's important to her? Some women say, this has been an entirely stressful experience. I would rather have my breast removed and not have to worry about a recurrence or worry about anything within the breast, even though I educate them that you have an equal risk whether you undergo mastectomy or breast conservation therapy. It all comes down to personal preference at that point.
What about risk factors? You say the risk factors remain the same whether you have one or the other?
That's correct. When you undergo breast conservation therapy, what that term means as a whole is you cut out the breast tumor and a few centimeters of breast around it. Following that, you have to undergo radiation to the resection site because that decreases the risk of it coming back in that area. And when you undergo the radiation, that makes it an equal treatment to a complete mastectomy.
Talking to Dr. Byron Dodson this morning, surgeon, Mon Health Surgical Care. With reconstruction, if the clinical nature or the size of the tumor does require the mastectomy, and you, I think, alluded to this just a little bit earlier, are there reconstruction options, or what's the option at Mon Health?
Yeah, absolutely. We work really closely with Dr. McClellan, who's a private practice plastic surgeon that works with our hospital, who can do immediate reconstructions. Oftentimes he puts in tissue expanders and then comes back later to put in a true implant. And there's also some reconstructions that involve just the natural pieces of your body that can be rotated and put into the area.
Talking to Dr. Byron Dodson, surgeon, Mon Health Surgical Care, and our subject this morning, breast cancer surgery. Got to squeeze in another break. We'll continue our conversation right after this. You're listening to Mon Health Talk on WAJR.
This is Mon Health Talk, providing a window into the Mon Health system and the dedicated healthcare providers who work there. If you'd like to comment or ask a question, please call 304-296-0041.
Got a few minutes left with Dr. Byron Dodson, surgeon, Mon Health Surgical Care, and we're talking about breast cancer surgery on the program this morning. And Dr. Dodson, what are some of the most common questions you get from patients when consulting with them?
So, generally speaking, every patient's number one question is this curable? They're very interested in what their options are, how painful they are, if there's any benefit between having a mastectomy versus having breast conservation therapy.
When we discuss, I think it's just about every procedure we talk about on this program, from a wide variety of topics, we always seem to come back to how much things have advanced, how far things have advanced, and how much you have minimally invasive options that used to take maybe a couple of days stay in the hospital. You get to go home much sooner. I'm going to go out on a limb, and you can tell me if I'm wrong. It's happened once or twice before. I would say the same is probably true in this area as well. How far has the technology advanced and the procedures advanced over the years?
Yeah. So, the amazing thing about breast cancer and cancer care in general is it is such a rapidly progressing technology. There are so many molecular markers that are looked for, and there's targeted therapies for specific characteristics of each individual patient's tumors at this point that can really, benefit their long-term recurrence rates and their quality of life thereafter. The surgery itself, breast conservation therapy was groundbreaking when it came out. In the past, we did axillary dissections on people very frequently, which is where you remove every lymph node from under the armpit, and that often resulted in people with terrible swollen arms. Now the technology allows us to do sentinel node biopsies where we only take the one or two first draining nodes, which really decreases the rate of the risk of that swelling, which can be very miserable for the patient.
Talking to Dr. Byron Dodson this morning, and the key to all of this successful surgery, successful recovery, is detecting the cancer as early as possible, and part of that is obviously getting the annual mammogram. So where can patients get that done, and how can they schedule an appointment?
Yeah, so within our health system, we offer 3D mammograms in Morgantown, Fairmont, Grafton, Weston, and Kingwood. If they visit monhealth.com/mammogram, they can schedule.
Do you ever hear from patients after the fact? I mean, obviously you follow up with them, but after the fact, and they come back and say, kind of a follow-up on how things are going long after, hopefully?
Yeah. After surgery, I see them at 3 months, and then I see them every year thereafter, trying to have them get their mammogram the day done prior to my office visit with them. That way I can go ahead and review the results with them. As you would imagine, it becomes a very anxiety-provoking screening test once it's positive once and you undergo surgery and treatment. So trying to streamline that and make it as pleasant as possible for the patients is the goal.
But being able to improve quality of life and give patients that that second chance, because cancer obviously is scary no matter what form it is. Breast cancer is so common, it's scary, but having that assurance, having that, I don't know what the word I'm looking for here, Doc, is, but, having a team and knowing that care is available there for you, that can put one's mind at ease at least just a little bit.
Absolutely.
What do you want folks, patients who might be listening today or folks listening today, what do you want them to take away from our conversation?
I think the important thing to realize is screening is so important. Having screening done results in more minimally invasive procedures and better outcomes. So it's so important to, see the pink ribbon, remember to get your yearly mammogram, and whether you get that through your gynecologist or your primary care provider or a surgeon that you've known from past experience, it is such a crucial part of women's health care.
I would imagine many of your patients went in just for their regular appointment, and that was that caught something very early, and you were able to catch it and detect it and be able to treat from that point on, and that just kind of underscores the importance of the annual checkup, the annual mammograms, and just doing the regular routine, right?
That's exactly right.
Talking to Dr. Byron Dodson this morning, surgeon, Mon Health Surgical Care. How can people reach out to you? Will they get a referral from their PCP, or will they make an appointment directly with you?
Yeah, so depending on their insurance, most people can schedule with the surgeon directly. However, referral from a PCP is the most common way that patients schedule. Visiting monhealth.com/mammogram or monhealth.com/cancer gives access to all of the surgeons for scheduling.
I think I know the answer to this question, but I'm going to ask it anyway. What's the best part of your job? At the end of the day, what makes you kind of lean back in the chair and grin and go, this is why I do this?
It's truly helping people. I love seeing these yearly patients, 5 years out from their cancer surgery and seeing that they never had it come back. And, I have young children, so a lot of times with these patients, we're exchanging pictures of our children or their grandchildren, and just getting to see that patient continue their life and their children grow up is just so rewarding.
Yep. I knew the answer to it. I hear that so often, and I know it's sincere, but I knew that was going to be the answer, but I wanted to hear it from you anyway. Dr. Byron Dodson, our guest this morning, surgeon, Mon Health Surgical Care. Again, you can reach out to monhealth.com/mammogram or monhealth.com/cancer to get your 3D mammogram scheduled up. And those are offered in Morgantown, Fairmont, Grafton, Weston, and Kingwood. Again, monhealth.com/mammogram to schedule today. Dr. Dodson, appreciate you stopping by today.
Yeah, thank you for having me. Take care.
Absolutely. Dr. Byron Dodson.